who are here today, and Julia Tedesco from Foodlink. And you know, this is really, I'll just say this, just one example of many across the community of people coming together, our towns, our county, state, federal representatives, and our nonprofit organizations to roll up their sleeves and figure out how do we help people who need that extra support at home, because you know, we're facing right now something that's unprecedented, and I know there's a lot of concern in the community, a lot of anxiety, particularly around access to food. And I think one of the things that is important here is that everybody work together. I talk a lot about the fact that we all have a role to play as we get more and more cases that are confirmed here and the virus continues to spread and people get sick. We all have a role. Our healthcare professionals are working around the clock to make sure that we're keeping people healthy. Our law enforcement, first responders, EMS, fire, they're working to keep people safe. Our nonprofit community, Foodlink, our towns, they're all working to make sure people are fed and have access to social services. And the community at large all has a role to play too. We are all soldiers in this war, and their job is to stay home. If you're not currently engaged in an essential function, and I think the governor's office has been really good about trying to help people define what those are, but if you're not part of that essential function and you can work from home, now is the time to do that. It's to practice safe social distancing so that we can slow the spread, lower the curve, so that those healthcare professionals, those law enforcement that are out there, and all those folks who are doing all the other services can stay on top of it and manage what we need to manage over the next several days. So my message to the community is this: while we continue to increase the number, while we continue to put out there the numbers and they continue to increase every day, what I would say is that we've talked a lot about this. Dr. Mike Mendoza has talked a lot about the fact that we have community spread. So it's out there. There's more cases, we're sure of that, than we know about and have tested positive. So we need to behave that way, and that's why this is so important. And you know, in pulling these things together across the community like this are so important. So I'm also delighted to really be able to also introduce Julia Tedesco today, too, from Foodlink, because the one thing that has been really eye-opening and is really the untold story of what's happened over the last week is how quickly our nonprofit community and how quickly the essential service the providers in our community have mobilized to be able to help thousands and thousands of people across our region. This is what makes Monroe County so special, and what's happening today is really why we're going to come out of this on the other side okay, and we are going to be okay as a community, and we'll get through this because we have such a caring group of folks around here, such caring nonprofit community and community-based organizations that are helping people every day. And Foodlink right now is being led by Julia, who's going to come up here and say a few words, who's really stepping up to make sure that folks in this community have what they need and the resources to get through this. So thank you. Yep.
I want to thank County Executive Adam Bello and Town Supervisor Seeley, and certainly Congressman Morelle, who has been instrumental in orchestrating a collaboration between government entities and nonprofit entities to respond to the need right now. So what you see here today is really due to our partnership, Foodlink's partnership with Irondequoit Food Cupboard and their president, Debbie Evans, who's on the front line 365 days a year. She knows this community. She's always serving this community. And what you're seeing is hundreds of residents from Irondequoit, low-income residents, vulnerable residents, receiving 50-pound boxes of food in a really controlled, safe, calm environment, and that's what we hope every emergency food distribution for the time being looks like. I want to recap what Foodlink is doing to respond to the need right now. As you've heard throughout the past week, we continue to do meals every single day, targeting school-aged children in the city of Rochester. We're doing more than 4,000 meals every single day to 16 sites, and that's in collaboration with RCSD and City of Rochester, who are doing another at least 8,000 meals as well on a daily basis. We will continue to do that. Again, that is for school-aged children in the city of Rochester. Separate from that is what we are doing for emergency food distribution. Again, every single day of the year, we have a network of hundreds of community-based organizations across the 10-county region who supply emergency food to families in need. Many of those agencies are still operating. They're still accessing food from Foodlink, and we're encouraging them to do so. In addition, we are building and supplying 10,000 boxes of emergency food supplies like you see here today, core food items that can help sustain families. We are getting those out to our residents, again, across our region through our existing network of partners. These are emergency food agencies and nonprofits that do this day in and day out, and as long as they're able to, they're going to continue to partner with us to do that. We're not looking for new sites at this moment, but we're constantly receptive to what's happening to the community and evolving our model. And so if we need a different method to get these boxes out, when we hit that point, we will have a different method. But for now, we're working with our existing partners. We're going to try to make that information available to residents when it becomes available, where those boxes will be, while also trying to maintain a safe and calm environment. We don't want any site overwhelmed with thousands of people if we don't have the supplies available to get it to them. And so we're working with 211 every single day, sometimes by the hour, to make sure they have updated information. And I want that message to come through, is that 211 is the source of this information. There is no doubt they are working as hard as they can, but being overwhelmed with the amount of information coming their way. So we have committed with them that we're going to work as closely as possible to get the information. The emergency food box distributions we're talking about at our existing partners, we will update them. The list will be complete this coming Monday, and you can expect distributions throughout the following 2 weeks. But of course, that's not the end of the story. We're looking ahead into further weeks and months and preparing second and third phases of these emergency food box distributions. We're asking manufacturers and anyone who's able to donate case product for this effort to do so. We're tapping into our supply chains to get product into our facility as quickly as possible so we can continue to meet the need, not just today or tomorrow, the next 2 weeks, but for the months to come. And we'll continue to be as prepared as possible.
Every day we get calls from people to the station who say that they're food insecure. I'm wondering what the eligibility is for these boxes. What do they need to do? Is there some criteria they need to meet?
Yeah. Foodlink's focus is to serve the most vulnerable, the most at risk during this public health crisis, and always low-income households. So that is going to be our priority, and we ask everyone in our community to prioritize those individuals when it comes to emergency food as well, because we know that our great partners like Wegmans and Tops are working as hard as they can to keep their shelves stocked and be responsive. So we're asking for people who truly need emergency food to be the ones that come forward. That being said, we are not means testing individuals. We are not asking for a lot of information or paperwork in order to receive this emergency food. We want it to be as accessible as possible to those in need.
And they should call 211, right?
They should call 211, and we're asking for patience because 211 is also a nonprofit organization working as hard as they can to get the right information. But what they can do is if you give them your zip code, they will tell you the closest pantry and let you know whether it is open and able to serve. And if it's not, they'll give you the name of another one.
Thanks so much.
Thank you.
Can we do off topics?
Yeah.
Adam, perhaps? Just, if you could expand a little bit more your reaction on
Related topics, yeah.
your reaction to Governor Cuomo just recent within the last hour going to 100% enforcement, except for
Right.
non-essential services.
Yeah, I think that's the right move from the governor, and I think that's absolutely true. I think that's absolutely the right step to take, and I hope that people who are at home are paying attention to these announcements and following these recommendations and these guidelines and these orders that are coming out of the state, because the biggest concern that we have going forward, in addition to people's health and making sure that we slow down the spread, is also to make sure that the hospital systems are prepared and that we have the capacity to help everybody who could become sick. And so our job is to then spread the curve. It's to lower the curve. It's to stop that huge spike in numbers that could potentially happen that we've seen in other places around the world. And I think the best way to do that is for individuals who are not working in an essential industry to keep things like food distribution going, hospitals, healthcare industry, utilities, things like that. If you're not in those fields and you can work from home, you should be working from home at this point to stop that spread as much as you can. Yeah.
My question is either for you or Congressman
Sure.
Morelle. The governor just said that 10,000 tests were done just yesterday in New York. But what we're hearing from upstate residents is incredible frustration because they can't be tested. Testing is much more limited here. I was just wondering if either of you use some of that influence to assure that upstaters are getting our percentage of tests.
Well,
Do you want to speak to? Yeah.
I just This is one of the great frustrations I think many of us have expressed around the country, is the lack of response by the administration. The problem here is that you could have test kits and machines to be able to do testing, but you need a special reagent, depending on what kind of machine it is, to interact with the sample that gives you the positive result or negative. And those reagents have not been available. So the president has invoked the Defense Production Act, which allows us to go into industries that make one thing and to basically demand that they make a thing that's in the public interest. And we need to do that more. There is, and we have talked to the county executive, and I have daily calls with our health systems, the hospital heads, etc. They are desperate for those reagents. They are desperate for supplies. We continue to talk to our state partners. We talk to the federal government to say you've got to ramp up production and you've got to do it immediately. So we're arguing as much as we can for those supplies. Obviously, New York City is the hot spot across the whole country, and they have thousands of people who need them. Right now, effectively, people are getting the tests are hospitalized or in serious condition. That's why they're sort of prioritizing at the hospital and healthcare systems. But as I keep saying to people, don't let that lull you into a false sense of security. Simply because we have 30 positive tests in Monroe County, I think that's the number right now, just assume that it's not those 34 people, that there are hundreds if not thousands of people who have potentially been exposed. They need to stay home, need to stay away from other people who they could give the disease to. So we're working very hard to try to get those supplies, and frankly, we're very, very dissatisfied with the response we've gotten. Hopefully the administration in Washington will be able to respond much faster in the days ahead.
Congressman, speaking about the administration, there seems to be a sentiment out there, and I know Cuomo touched on this, that we're seeing every state doing something for their state. Where is the unified approach to all of this? We're watching California, you know, taking drastic measures, a population of 50 million going down to saying 25 million could contract. What's going on with the government? I mean, what is your take on all of this? Why there is no uniform voice, and people are kind of scrambling, doing what they think is right in their community, but yet, are we headed for a total shutdown? I mean, what's the answer? China did it. I mean,
well, look, I think, you know, one of the differences is Chinese government, obviously, because it's a totalitarian form of government, has an ability to shut things down. I would not be surprised to see some kind of national quarantine, similar to what California and New York have done. And we have been, and I have tried very hard not to criticize government partners. Everybody's working hard. But I think the administration in Washington has been slow to come to the conclusion that this crisis is a pandemic. I think they have been slow in their response. I think the president should be would be better for him to allow his scientists and the people who are running the agencies to speak up and get what they need. So we're going to try to continue to work with everyone and restrain ourselves when it comes to criticism. But this needs the greatest amount of support from the federal government, because people like Adam Bello and people like Andrew Cuomo and people like Lovely Warren and others, we're trying the best we can, and we're coordinating, we're talking to our not-for-profits. This demands a national response of the highest order. And frankly, this demands international cooperation. I mean, in China, they haven't seen new cases. China is going to be able to reemerge industrially. They're going to be able to supply us with ventilators and masks. So I would urge the president to stop using the phrase Chinese virus. It's not helpful on an international stage. We have people, if we don't create more ventilators, if we don't get more masks, if we don't get more supplies, people in America will die. People in Europe will die. People around the world will die. Let's stop, put all that stuff aside for the moment. Let's get our supplies. Let's get our industrial base up. Let's get international cooperation. Let's shut this thing down before we do irreparable damage to people and human lives and the economy, the global economy, which is at stake right now.
Congressman Morelle, oh, I'm sorry. Could you define national quarantine?
Well, I
Does
think
that mean mandatory quarantine, and if you leave, you could be fined?
Well, I think what we will do is what California has done, what New York's doing, is to essentially define what essential industries are and essential employees. Everyone else, to the greatest extent possible, should work at home. And if you can't work at home because you're a caterer and that doesn't work, then you're going to have to stay home. And we are going to work with the federal government, with our partners in the Senate and the administration, to fashion the third and fourth and fifth relief package. And we'll be in Washington, I'm sure, next week approving that or doing it somehow remotely. The federal government support will come, but right now people need to be home, need to stop the spread of the disease, need to flatten the curve so that we can come out of this in a month or two and then begin to rebuild.
What would be the tipping point, do you think, that New York will take the decision to do a complete shutdown?
Well, I think New York has done it. I think the governor announced that today. Essentially 100% of non-essential employees need to be home. I think that's what the United States government, I hope, is considering. I think it's there's going to come a moment, and it's fast approaching, if we haven't already passed it, where we should issue the same thing. I mean, the videos, I think we've all seen them, of people on beaches in Florida basically saying, look, we've looked forward to this vacation. I'm sorry, it's not okay anymore. You can't go out, you can't socialize, you can't be with people, you're spreading the disease, and frankly, if you think you're invulnerable to it, you may be because you're young and healthy, but you may have it, and if you pass it along to someone who has a immune system that's compromised, or someone who has long-term health issues, you may be sentencing them to some serious illness or worse.
For New York State, is this about as close as we can get without actually calling this a total shutdown?
Well, I think effectively, if people haven't heard the message from the governor, who's been out there repeatedly, and the county executive and the mayor and everyone else who has a voice saying, please stay home, take this seriously. I have an 84-year-old mother. I call her several times a day. Mom, if you need groceries, I'll drop them off at the back door. I'm obviously not going to come in the house. I want to make sure you're okay. Last night, every one of my children, grandchildren, brothers, sister, mother all got text messages from me. Call me if you need anything at all, but I'm not going to visit you. I want to make sure you're okay. Everybody got on the chain. I want to encourage people to do that, because this is critically important to the survival of people, and it's important for us in terms of our economic survival going forward.
I have a question for County Executive Bello. So I have been in touch with the family of Alvin Simmons, the man who died. And he lived with a second grader who has now been ill for 5 days, running a temperature. I was just wondering if there has been a coordination with that child's school, because that last week of school, of course, he was in school every day.
Well, I'd have to talk to the Department of Health about that, so that's a question for Michael Mendoza, but we can get you an answer to that. Absolutely. Sure.
Quick question.
Yeah.
Heard ADT, both buildings closed, a note, employees showing up saying that somebody tested positive, and they closed the buildings at 8 o'clock last night.
I don't have any more information about that.
Final question.
So, yeah.
Everybody's at home watching you, and we're bumping into people all the time, and I think I'm getting this constantly. How much longer? And if anybody had a crystal ball, I understand.
Yeah.
But I mean, this is what's on their mind. I mean, people are like, when is this, and there is no answer, but yet what would you say to people? I know I heard you a little bit.
No, I know. No, I think, obviously there's a lot of uncertainty. I think, we've heard, that we're talking about weeks, not days. And I think that, the governor has talked about, if we keep on the same curve that other countries have around the world, we could be looking at this peaking in 45 days or something like that. I think here's what we can do. We can change that, though. That's the thing. We have that in our power to change how long this is going to take by listening to the advice we're getting now and listening to the instructions, which is to social distance ourselves from each other. It's to stay home. If we follow the advice that's being given, and I think that, one thing you said earlier was about, different responses from different governments. Actually, in New York State, I think the governor's doing a very good job, and we are giving out these directions to all of us, and we have a very consistent message. I said 2 days ago that I think if you're not in an essential industry, you should go home, and we're doing that. If people follow that and stay home and stay away from physically from the vulnerable and older people in this community, we will get through this. We will get through this, but we have to follow that advice, and we have to get the message out. And I'm telling you, just driving here today, I'm seeing far too many cars on this road. I don't know where these people are going. If you're not in an essential industry, and there's not something you need to do related to healthcare, law enforcement, first responders, if you're not in utilities and all those things that the governor and the New York State did a very good job of listing out, then you really should be going home.
And we should really rely on that list for guidance.
Yes,
we had lots of questions about what is essential. Right?
Yes, and there's a lot of guidance out there now. I would also tell you to go to our website, monroecounty.gov. We're linking to all of that information, and also New York State ESD, Empire State Development, has also made themselves available. So if a business or company has questions about whether or not they're deemed essential, they can ask that question and get an opinion for that. So, but use our website. Use our website. We're linking to all that information about what's essential, what's not. We're linking to information about the disease disease itself. We have a hotline, 753-5555, so you can feel free to call that as well. And we also have information about social service programs, daycare, SNAP benefits, unemployment, all the unemployment benefits, all those things we link right to on our website. So, all right, thank you, folks. I appreciate it today.